One of my goals right now as a leader of nurse navigators is to really get the message out there. And part of that is to do presentations across the country and also to publish articles. And so in a recent literature search, I was able to find much work that's being done in places across the country and even in other countries focused on nurse navigation for chronic disease. There was one article from Queensland, Australia, that was very interesting, where the government and the health departments had joined together to ask health systems across Australia to focus on starting nurse navigation programs. And they were focused specifically on people that were disillusioned with healthcare, that felt disconnected from healthcare. And the nurse navigators were asked to really partner with low-income, high-risk patients and help them to get a primary care physician that would be managing their care, understand their medications, and help them find financial support to get their medications, and help them to have faith again in getting health care in Australia. And the government was instrumental in helping to fund those programs to get started and collecting data to demonstrate that the health outcomes were increasing. And so the hope is that in the future, that will be a permanent part of healthcare delivery in Australia. In our country, there are pockets of studies that are happening. The role of advanced practice nurses should be focused as well on population health and nurse navigation, and having bachelor trained registered nurses in primary care is pivotal to making sure that in that primary care setting, we are immediately connecting patients with nurses that are capable of helping them navigate, connect with resources, and get the help and support they need. Right now, there's a trend where nurses are not in primary care offices. So that is something that really needs to change. And articles are demonstrating what happens when nurse navigators are involved in care and health outcomes do improve, the patient experience improves, and the cost decreases.